Hi, everybody. Dr. Kelsey here again from KML Academy, where we are anchored in science, guided by intuition, and always personalized for your path. Okay, so what are we doing today? Well, today I thought we would do a little bit of exploration into the world of eating disorders and eating disorder treatment. Honestly, you might think, since I'm an eating disorder expert, that this must be the easiest thing to present on, but actually it's kind of the opposite. When you're an expert in something and it's what you've done for your entirety of your career, it can actually make it really difficult to break down what might be the most important points to talk about. So that means I need you guys to partner with me and add in the comments, things that you want to know that I'm not covering. Okay, so let's get started. What I want you to know about eating disorders is probably the most important and first piece of information that I can give you is that it's really important to not assume that we can look at somebody and know what type of an eating disorder they have. That is absolutely false. If there's one thing you can take away from this, please take away that. And I also, if I'm speaking to any of you out there that maybe you've experienced that before, where somebody looked at you, maybe it was even a healthcare professional, maybe you went to the doctor's office and they took your weight and they assumed something about you. And without even asking your behaviors, they said, maybe this diet plan might be a good thing. Or if you lose this amount of body weight, your knees will be better. Okay, so, or maybe you've had the opposite where somebody's assumed, your eating habits in the opposite direction if you tend to live in a smaller body. So we really want to get an awareness to the fact that we cannot look at somebody and tell what their health is and understand what their eating habits or their lifestyle or anything like that might be like. It's a very, very important topic, and it's a big one because in and of itself there's so much weight bias out there, and that is a massive topic that I could spend an hour on, but I'm going to try not to because I try to do these videos in less than 10 minutes. So that's one thing. Okay, another thing is that there are many different types of eating disorders. First of all, you can have disordered eating, which is technically what we look at as being a subclinical level where maybe you're manipulating your eating, you're trying to get something out of that. However, it might not meet DSM criteria for an eating disorder. It doesn't mean that it's not bad or that it's okay. It just might mean that maybe you can also be functional in your everyday and maybe people don't know about it. There is also a few major eating disorders that are important for us to know about. So the first one is the ones that we think about, when we think about an eating disorder, we probably think about anorexia nervosa, which is a term that means the person is probably restricting their food in some sort of way. They're not taking in what their body needs, and they're doing that intentionally under a certain amount in order to likely kind of change their body weight or shape in some sort of way. Okay. And possibly they may be at a low weight. That's what we generally associate with it. Having said that, as I noted before, it doesn't mean a weight does not mean health in any sort of direction. So we can have somebody who has very significant anorexia nervosa that is actually living in a higher weight body. That's what we call atypical anorexia. And oftentimes that's overlooked or not noticed because we do not presume that someone in a larger body might have a restricting. It is probably a misunderstanding from the general public to think that people with anorexia just don't eat, don't like food, never get hungry. That's not the case. So please understand that. On the flip side of that, you might have heard binge purge, often associated with what we call bulimia. And that is another one of the major eating disorders that we find in the DSM. And what that one means is generally, typically, that you have a presentation where a person might be consuming food, and sometimes the binge part of it may be large amounts of food, and then they're compensating for that in some sort of way. They don't want the food in their body. They might be afraid of it, how it's going to affect their weight or their shape or whatever that might be. So they may purge. There's also binge eating disorder. That is a disorder that has been highly overlooked and associated maybe with food addiction. I think we get those things confused. Again, we also think of binge eating disorder. We get that frequently confused with thinking, oh, somebody's binging, therefore it must mean something about their weight. I'm going to be able to see that. Not true. Just like you can see anorexia in higher weight, larger bodies, you can see binge eating disorder in smaller bodies. A body does not determine the outcome of what the disorder is. I've now said that probably 5 or 6 times, so I'm going to keep saying it. But I want you to think about that. So binge eating disorder means it's very similar to kind of the presentation that might happen in bulimia, where we have consumption of a large amount of food. But instead of compensating, now we don't have the compensatory behavior. We have the shame, we have all of those challenges, the spiraling related to it, but we don't necessarily have the compensatory behavior that rids the person of the food. And those are some of the major distinguishing factors. Another major eating disorder that has been more recently recognized on a public level is what we call ARFID. So avoidant restrictive food intake disorder. This one's a little different because this particular disorder is not focused on weight or shape or trying to change the body. In fact, the person might be distressed if their body does change or if they do lose weight. They are not necessarily looking for that. So then what is it? Well, they are restricting food, and generally it's for 3 major reasons. The first one might be some sort of a trauma. Maybe they had a food trauma. Maybe they choked on something, or they have a fear of choking. And now that's restricting them. Things don't feel safe that used to feel safe. The second one might be if there is a lack of food interest altogether. Maybe the person has never really had a food interest. Usually you see that under like a feeding disorder that happens early in life. And then the third one tends to be if there is an association with some sort of a sensory texture issue, things like that, that have kind of weeded down what the person is willing to or capable of eating over time. And this is very different than picky eating. Picky eating, we might throw that term around a lot. This is not picky eating. Picky eaters can generally still be healthy and well, and they might grow out of it and all those things your pediatrician might tell you. But avoidant restrictive food intake disorder is fairly serious and can come along with just as many of the medical complications as any other eating disorder, because the person is not getting what their body needs. And that can lead to major issues over time. Generally, this happens in young children as they're growing up. So think about that. They're not getting the vitamins and the nutrients and all of that to be able to grow, to be able to do the things that kids need to do. So they can have medical complications. They can fall off their growth curve. Things like that can happen. It's all treatable, and there are things that we can do about it. When we are treating eating disorders, please go to someone who knows what they're doing. This is not a general mental health issue. It comes along with it. We have co-occurring disorders like anxiety, depression, PTSD, all sorts of stuff. However, it is not general mental health. So if you go to somebody who is a generalized trained clinician, they could have all the most wonderful characteristics of a clinician in the world. But in this one particular area, they may not be very effective, and actually they can set you back unintentionally. So you want to make sure that you're interviewing your therapist or psychologist, and that you ask them, do you have eating disorder specialized training? Do you know what you're doing? Where did you get your training? Because that makes a difference in this particular field. And the other thing is that I want to leave you with today is the importance of working on a multidisciplinary team. These disorders are not like other disorders where you can just see a therapist, if you have anxiety or whatnot, or depression. It's a mind, body, whole body disorder. And so a therapist is going to be able to help get in there and kind of like get things out and figure out what it is that is impacting it. But they're not going to know what's going on with your body. So we all need to be working together. And the best, most comprehensive team would be to have some sort of a mental health practitioner, to have a dietitian who knows eating disorders, not any old dietitian, but a dietitian who specializes in eating disorders, and to have a medical doctor or provider who also specializes in eating disorders. Psychiatry is a great additional option. Last thing I'm going to tell you for today, and then we'll go into a part 2 and 3 and 4 and million, what is eating disorders, is please understand this is not about the food. I promise you, this is not about the food. The food is a symptom of something much, much deeper happening within the individual. The food is important. We cannot ignore it. We have to address it, which is why we have a dietitian, which is why we, do the blood work and we have a meal plan and we need to nourish the body. We can't just do the therapy without the nourishment through the food and treating any medical complications. However, the food is a symptom of something much deeper. People do not say, I'm going to start my eating disorder tomorrow and then wake up and have an eating disorder. Even if they think they did that, and I have some people who swear they think that's what happened, I promise you the thoughts have been happening for a very long time. It's managing something else that is on a deeper level. It's absolutely critically necessary to recognize that in relation to an eating disorder. There is always some sort of a lock that a person has been holding on to and they're afraid to let go. So we don't want to demonize the eating disorder, but we want to understand it and the role it played and the needs that it meets so that we then can get in there and actually get those needs met in a healthy way. I always tell people the need is not the problem, but the way that we're getting the need met is absolutely a problem. And when people come into treatment, it's because the thing that it was doing for you and the thing that it's now taking from you, the scales have tipped and now it's taking more than it's giving back. And it's time to get that healed because you deserve healing, which goes into the trauma stuff, you guys. So if I've done several videos on that now, I'll continue to build those. I will stop us here. I apologize if this one's going to be a little bit longer than Science in 10 minutes, but it is important to get a good foundation of what eating disorders are as we build in our next parts of the series. You know how I end every video? I want you to remember always that you matter, you deserve, and you indeed are enough.